Hello students, this is Dr. Praveen Tripathi and I have with me Dr. Zainab Bora. And in this videos, I'll be asking ma'am about the 5 problems that all of us believe have been a part of this whole PG medical entrance preparation and how does Cerebellum plan to solve it. So first and the foremost ma'am, the videos. The duration of videos has ballooned up to many hundred hours and I think there would be hardly any student who can complete those videos and forget about the revision. And one of the reasons I believe is that the content is being lazily added without putting efforts and refining it. So how does Cerebellum plan to solve this issue?
Sir, I think the one problem that you have addressed is about the strike rate. People are talking so much about having questions being included from their content that they are forgetting that ultimately the strike rate which matters is what the student remembers while going into the exam hall. So our focus with the videos is going to be the fact that it has to be revisable, it has to be concise, it has to be relevant, it has to be crisp. Something which you are supposed to remember while going into the exam. So there is a lot of unlearning that we are focusing on rather than learning. That is going to be the difference. We do not want quantity, we want it to be concise and relevant.
So when we are saying that rather than obsessing about the strike rate of the institute, will we focus more on the success of the students?
Absolutely.
Second thing, Dr. Zainab, I believe is that another reason why the content is ballooning up is that the integration is not really happening. It's easy to say that everything is integrated, but unless teachers come together, sit together, plan together, this integration is impossible.
Yes.
So are we taking care of that?
Absolutely, sir. I think we have been, integrating subjects, we have topics, which are being overlapped in different subjects. So we are consciously trying to bring it all together so that the content becomes more and more concise for you. It becomes something, which is there in one place for all of you to revise rather than in 3 different subjects. We want to bring it all together. We want to link, something that you are supposed to do. We will help you take that journey towards the next exam. That is going to be the approach.
Third thing, Dr. Zainab, we were discussing it a couple of days back. Certain questions in the existing Q banks, I believe that they are more to impress rather than being relevant. I mean, there have been instances when students talk to their PGs and SRs and they say, why are you reading this question? This is a SS level question. But they are everywhere. So you being the architect of the Q bank, can you tell us how are we trying to solve that issue, the Q bank issue?
Sir, so the main buzzword with question bank is they are going to be based on the previous year questions. That is something which is the most important. We are analyzing the trend of the exams and we are designing a question bank that is going to be useful for the students for the upcoming exams, looking at how the exams have been conducted. So it is heavily based on previous year questions, which is something which we are aiming for rather than giving them hi-fi content which something which will not figure in the actual exam. We want to take you towards the right journey. So it has to be relevant to the previous year questions. That is what we are aiming towards. And the second thing, which is something which is our motto, is we want it to be as error proof as possible. So we are consciously making it a 3-tier system wherein a faculty designs the question. It is being seen and verified by another set of faculty and then it goes to the subject wise expert. So it is being verified at a 3-tier level such that we bring you content that you can actually trust.
So we are not aiming to impress students, we want you to get selected. Don't get impressed by us, but get selected. Dr. Zainab, another issue. Many students say that, sir, it becomes difficult to maintain the discipline with the app. So are you planning anything to ensure that problem is taken care of?
Yes, sir. The problem with the apps is that there is recorded lecture. There are multiple recorded lectures, but ultimately when it's there without any sort of a live lecture to support that, I think it becomes very monotonous. Live lectures have that connect, which is irreplaceable by any recorded content. So what we have planned to address that is bring in-app live sessions to keep you in check, to give you MCQ practice such that, we have a real-time assessment module. You study this and then you come to us. So that keeps the connect alive, that keeps the motivation alive for the students to study.
Last thing, Dr. Zainab, you guys are everywhere on the social media, YouTube, Instagram, Facebook. Every day somebody is coming and talking about it. So is it all this interaction, is it till the app is bought or do you plan to continue with the support even after that?
Absolutely, sir. I think there is no doubt for students who know us They know that we've been through them through the entire journey. So there is absolutely no doubt that after the app launch, I think we are going to be more in your faces than we are actually now. So the support is going to be ongoing for sure. Any issues that you have, you know where to reach us, and we are going to be there with you throughout the journey until you crack that exam and get that dream branch of yours.
Ma'am, just an add-on, the frequency with which the founders and the faculties are using the word cerebellum, don't you think our cerebrums are getting jealous of our cerebellums?
Sir, I think we need to get the balance right in. We need to stop using cerebellum so much.
Alright, thanks a lot, ma'am. Thank you.
Thank you.